So patients would come in to have lip fillers for a variety of reasons. It might be to enhance what they have naturally. It might be to restore volume loss as we lose volume as we age. It might be to improve the proportions of the lips or to achieve a better overall balance with the face. So I'd say out of pretty much every treatment we do, lip fillers would be the one that patients would be most nervous about. And they'd also often be nervous about what their partners would think. It's important to note that it can actually be done in a natural way. There's a lot of what we'd call trout pouts out there, where there's an excess of filler injected, especially into the upper lip at the edges, and it almost protrudes out. With social media, Instagram, this era we're in, we can look at photos and think that they look desirable, but we need to look at lips in particular with a side profile, in animation, making expressions as we're speaking, and to look at them in balance with the rest of the face. At the end of the day, the studies show that what people look for is actually a more natural look when it comes to lips. A lot of patients do worry about whether the procedure will be painful. It's actually often more gentle than they'd expect. The needles are quite small and the product is mixed in with a bit of local anaesthetic, so it numbs as it goes. There's just a little bit of a pinching feeling initially, and then a mild sting as the product goes in. But that's about as bad as it gets. We can definitely improve comfort levels by adding a little bit of numbing cream or even doing dental nerve blocks, but they're, to be honest, rarely needed. Having your lips done is a fairly quick procedure, no more than about 20 to 30 minutes, essentially just a lunchtime procedure for most patients. They might feel maybe a little bit numb for 20 to 30 minutes, that's about it. Lip fillers on average last about 6 to 9 months, the first time you have them done. Subsequent treatments for most patients would be about once a year. The two main side effects would be swelling and bruising. Swelling lasts about, on average, 24 to 48 hours. Bruising might take a few days to heal. It essentially isn't a downtime procedure as such, but we'd advise that if you have an important function or event on, to maybe do it at least a week beforehand. One other side effect you might have is you're going to look fabulous. So some patients do bring in photos that they've seen of celebrities or on social media. It's important to note that everybody's lips are different, the shape of their lips are different. It's very difficult, if not impossible, to change the shape of someone's lips. It's more about enhancing, looking at what's going to work with the rest of their face. Occasionally it might take more than one treatment to achieve the desired result. The product of choice is hyaluronic acid. It's a soft gel that mimics what we have naturally in our skin. The good thing about it is that it's also reversible, which means that there's a quick antidote to dissolve it. The idea of permanent and semi-permanent fillers might sound great, but in reality they're associated with a few more problems. For example, infections, lumps, the fact that they're not reversible, and also long-term scarring.